Absolutely. We have to have you exercise despite your SADS condition. So it depends. There's a lot of caveats there. What is your SADS condition? What is the presentation of it? But the notion that you must be shut down and no exercise and barely get off the couch and just walk slowly to the bus, those are messages that are old, outdated, wrong, and cruel messages. We need to figure out how to have an active lifestyle despite your heart condition. I think when our patients who have a SADS condition, whether they're an athlete, an artist, or an academic, when we do recreational sports, there's just awareness and readiness, taking your medicine faithfully, never missing a dose if possible, following the drill to a T. Those are ways to keep you as safe as possible. For our competitive athletes, we have for all of my athletes an EAP, an emergency action plan that says if you were to collapse and not regain consciousness within 10 seconds, we must assume that it's a SADS triggered cardiac arrest. We must activate 911 immediately, start chest compressions, grab the patient's own AED, automatic external defibrillator, and deliver a shock if instructed to do so. That's our universal emergency action plan. The great news, though, is in 23 years of all of my athletes without an internal defibrillator, that safety drill has never been activated. Good news. Yes, jump away on the trampoline. We love the trampoline as a family. Great, great memories with that. The internal defibrillator, once healed, so not immediately after the installation, but after the healing has been completed and your physician says you are good to go, I'm not worried about the trampoline. Have fun doing that. Maybe those rails so you don't get bounced off of the trampoline. I was a good bouncer. For long QT syndrome, not very many. The reality is after diagnosis and treatment, most sports are actually quite safe, and that even includes, believe it or not, swimming. So there's a well-known connection between swimming as a long QT trigger. That connection is almost exclusively LQT flavor number one, so LQT1. But after diagnosis, after treatment, the threat of swimming has been largely neutralized. So if I have a patient and swimming is their passion, it's their oxygen, I don't take that away from them, even if they are LQT1. There are others where it just gets difficult to have that emergency action plan, cross-country runners, who's their shadow, where is the AED, and so forth. But everything is tailored with the message of what you get to do, what you can do, rather than the list of can't, can't, can't. The list of can'ts is getting a lot shorter. Absolutely. Summer camp is an incredibly important part in a child's life and a family's life. I think the same thing goes with the summer camp strategy is, do we have that EAP, that emergency action plan readied? And just like a kid with a potentially life-threatening peanut allergy, we figure out how to do summer camp for them with their safety plan. A kid with diabetes or epilepsy, we figure out their safety plan. We can do the exact same thing for a child with one of our SADS conditions. So I am thumbs up on summer camp.